Congratulations to each and every one of you for saying yes to yourself and showing up today. By simply being here, you've taken an extra incredible step towards prioritizing your health, well-being, and personal empowerment. And that is something to celebrate. We are absolutely thrilled to kick off Bexley's first ever Women's Health and Wellness Fair, a vibrant collaboration with the City of Bexley. Thank you to Councilwoman President Lampke and Feibel for being here and supporting today, and the Bexley Public Library. Thank you so much to Paige and Zach for all your support in making today happen. Together, we've created a space for connection, learning, and transformation, all centered around each and every one of you. A huge thank you to the Bexley Community Foundation Wellness Grant for gifting us with those beautiful swag bags and the practical support from OSU's mobile mammogram unit, giving every woman the opportunity to schedule a potentially life-saving mammogram. That is not just wellness, that's empowerment in action. Today is about taking back the reins of your health, your joy, your personal power. You'll hear from the powerhouse presenters and thought leaders who are here to share wisdom, tools, and truths to elevate every area of your life. Let's get started with our first presenter, Kelly Schmidt, founder and CEO of Kelly Schmidt Wellness. Thanks, Kelly.
Hi, ladies, and a few guys. Thank you for being here. So I'm Kelly Schmidt, and growing up, my nickname was Stubbs, and it wasn't because I was short. So today's conversation is about weight loss. Oh, thank you. Oh shoot, I forget which way we're gonna go on this. I'll figure it out real quick. So my topic in the next 10 minutes is to teach you everything I know about perimenopause, our hormones, what is also called reverse puberty and weight loss. So let's begin. All right, I was right. Just disclaimer, I'm not a doctor, talk to your team, don't sue me. All right. Moving on, who thinks that perimenopause is diagnosed with a lab? Perimenopause, which can start at age 35 and go all the way to the average age of menopause, 51, is actually diagnosed by watching your cycle symptoms in your age and going from there. So there's actually no blood work involved. And I had a client the other day, she's like, oh, I'm in menopause. Actually, let me switch slides here. She goes, I'm in menopause. And I was like, oh. I was like, when was the date of your last cycle? And she's like, oh, a few years ago. Menopause itself is 24 hours. Once you have that one day, it's been 12 months since you've had a bleed. You're in menopause for one day. After that day, you're post-menopause. So a lot of the terminology we're not even familiar with. But estrogen itself is the queen of our hormones, and she's the one at play. Through our lifetime, estrogen increases. Perimenopause can start at age 35. The average age of that one day menopause is age 51, and after that is postmenopause. So this visual just helps explain that. And when we have these emotional feelings or symptoms, it's estrogen going on. So this is just a further timeline with some stats. There was a study done in 2022 by Dr. Kabeka. She has a well-known perimenopause book, and it showed that women recognize their first symptom at age 36. And a lot of women in their late 30s have no idea what is going on and how it's related to their hormones. And they might think, oh, I just had children a few years ago. I'm still trying to balance those hormones. But what is going on in reality is it can be perimenopause. So let's go into more of the symptoms. Also, symptoms can last 8 to 10 years before menopause. And post-menopause, you can also have symptoms. So don't worry, I'm going to have some good news here soon. So what is going on versus what people think is going on? So we might have heightened anxiety or depression. My next slide highlights this, but it's just a mind-blowing stat. When women are in perimenopause, we're at risk by 40% to be diagnosed with a mental condition. And that can be depression or anxiety. And a lot of women will be given antidepressants. And of course, we want to have a solution, but at root cause is a drop in estrogen. So symptoms can be more anxiety, depression. Our cortisol is more fragile. So our ovaries is what's producing, our ovaries is the organ producing progesterone and estrogen, and those ovaries are going in retirement as we go through perimenopause when we hit menopause. The organ that takes over in producing estrogen is adrenals. Adrenals are those little tiny organs on top of our kidneys that produce cortisol. So those adrenals are being asked of a lot more, and our cortisol is more fragile. I've realized, at age 41, I'm a lot more sensitive to things than I was 2 years ago, 3 years ago, 5 years ago. I also have more things on our plate, and I'm sure you do too. We have kids that are older that need 400 carpools, and then we have parents that need us as well. So we're in this sandwich generation where there's a lot more needs, but also our hormones are not helping us in any sense. So overall, symptoms can be low sex drive, insomnia. That's something I hear so often. Having a good bedtime routine and using certain tools can go a long way, but hormones are at cause there, and usually it's a drop in progesterone. Constipation, we want to make sure we have 1 to 2 snakes a day. And yes, I'm talking about poop, but I'm a dietitian, I'm used to that. But we want to make sure we're going to the bathroom so we're not reabsorbing all that estrogen. And as our estrogen drops, our motility, our digestive tract will slow down. So there's things we can do to support that. Hydration is key. I have my friend and assistant with marketing, Nicole, over there. And my absolute favorite electrolyte is Element, LMNT, and I brought samples of that today, so make sure you grab some. I highly recommend anyone in perimenopause, menopause, or postmenopause to have electrolytes on a daily basis. We need those trace minerals, and we need that hydration to fully help our digestion. Disease begins and ends in the gut. All right, I'm going on and on, but you can take a picture of this, but there's a lot of things that show up, but what's really going on is those adrenals and cortisol. What's going on is blood sugar regulation. As we age, we become insulin resistant. And also, there's a lot going on in the gut. I have such passion for the gut. There's a lot more needed research on the gut, but the gut is so important on metabolizing that estrogen. We can reabsorb it if we don't have optimal gut bacteria. So again, we want to eat as close to the farm as possible, eat more whole real food than not, do the best you can. It's not about being perfect, but also it's really helpful to have a probiotic or eating fermented food. Bubby's is one of my favorite brands. You can find it at the Giant Eagle Market, and you can also find it at Whole Foods, but those have so many live cultures, and I try to tell my clients, eat 1 pickle a day, 1 pickle a day. Something else that's incredibly important is our detox pathways. And we think, oh, the liver's in charge of detox. Our body should be able to handle it all. But we're inundated in toxins. I had someone come over to my booth already, and she's like, I finally got my daughter-in-law off Bath & Body Works candles. No offense, Bath & Body Works. I hope no one works there. But their candles are quite toxic. Those synthetic scents are so toxic for us to breathe in, let alone the perfumes we're putting on or the lotions, potions. All of those artificial scents are hard on the liver, hard on the body. So if you want to smell good, there's actually a line at Sephora that's more essential oil based, and then candles, look for essential oil and so forth. So I'm going a bit on a tangent, but what's really going on is deep at the root, and that's what I hope to help solve. This is kind of a further explanation of what I've discussed already. If you'd like, you can take a picture. But a lot of people may not realize, oh, my itchy skin, that's perimenopause. Oh, my sore shoulder, that's actually not one of the bullets up here, but I see often. My right shoulder always hurts. That's perimenopause? Yes, it can be. Thinning hair, heart palpitations. Again, going back to that anxiety, depression. There's a lot going on when our hormones are going down. And the average age used to be age 48. We're almost living double that. So there's new information, new research supporting hormone replacement therapy. And maybe Dr. Ryan will talk about that. I'll leave that there, but I think every single woman has the opportunity and ability to have an educated conversation with their gynecologist about solutions to support these systems and symptoms. But overall, as a dietitian, there's much that we can do before we have that HRT conversation, and I'll tell you what that is here in just a moment. Before I get any further, I just want to say there's hope, and we're all aging, and that's a wonderful thing. I've also noticed, too, as I've aged, at 41 now, I'm obviously transparent with that we're becoming wiser, we're having better boundaries, we're having bigger priorities, and really embrace that. So let's talk about the 3 pillars that you can support your health today before you're having those educated conversations, or just things you can tackle to support how you're feeling. And I want you to have the best quality of life possible. The 3 most important pillars that I bring up when I'm talking to someone about hormone balance is really protecting our stress levels, really protecting our cortisol. And my biggest saying in every realm is if it's not a hell yes, the answer is no. I just took a consulting role as a nutrition coach for a company. And I told the CEO, I go, well, this seems like a hell yes. He's like, what? And And I was like, I use that barometer on everything. If it's not a no, if it's not a hell yes, the answer is no. And I try to run that cross my mind every time I'm asked a question, because we need to protect ourselves. We can run ourselves very thin. And I'll get further into cortisol as well. But sleep is the secret sauce to health. If you're not sleeping, you're just spinning your wheels on chasing those other goals. So sleep does need to be prioritized. Second pillar, I didn't mention this, on my 8th birthday, I was diagnosed with type 1 diabetes. So blood sugar is something I know a little too well. But I really appreciate blood sugar control. As we're aging, as we're dropping our estrogen, we become more insulin resistant and we become more inflamed. So as you build your plate, it's not just counting your macros, but it's thinking about eating for your blood sugar control. I'll get into some quick tips on how to do that too. Last but not least is detox pathways. Guess what the #1 toxin is in our world? Anyone have an idea that comes to mind? Oh, that's a very good one. That might be number 2. Plastic. That's abundant. Did anyone see that stat came out last month, maybe last week, about chewing gum and how much plastic goes to the brain? Just all the news is just so inspiring. I no longer chew gum. So the biggest toxin in our world is actually stress. So again, I can't stress it enough. But when people say stress, I just suddenly start to tighten up. But stress can be a wonderful thing, but we need to make sure we're taking deep breaths. When we are working hard throughout the day while we're spinning the mini plates, just taking that deep breath tells your brain you are safe. So do that yoga breath and you're on the right path. And I have some more tips coming through. So I'm gonna break down these 3 pillars really quickly. I'm gonna watch Monette to see when my time clock's coming up, but we're about done here. So pillar number 1 is coddle that cortisol, chill as much as you can. We have, oh my gosh, garage, what's it called? Massage garage. We need to go to massage garage and do the sauna, get the massage, get the cupping. But we really need to prioritize those self-care things. Again, I can't say it enough. It's not a no. It's only a hell yes when it's a no. And having boundaries is really vulnerable. And that might be why people have a hard time with them. But it's very vulnerable, especially when it comes to family or close friends. They don't want you to change. But you need to protect yourself and realize what are your priorities and what are your non-negotiables. In my private practice, I use something called the GRACE method. The GRACE method is my 5 pillars of supporting someone's well-being in a holistic way. And GRACE stands for, it's an acronym for what those things are. And the R in GRACE is routines. When we have routines, we support our circadian rhythms. When we support our circadian rhythms, we support our cortisol. And when we have routines, it also, again, tells the brain we're safe. We have a lot going on, but if we have meals around the same time of day, that helps our digestive tract. That helps us break down our food better. That helps our appetite regulation in that insulin. Sleep, again, sleep is so important. If we are sleep deprived by 6 hours or less, and we're a very healthy individual. This is a study from 2012 done on men. But if we are sleeping adequately and then we have sleep deprivation up to 3 nights in a row, we can wake up pre-diabetic. When we don't sleep, it increases our insulin resistance. Already as aging, already estrogen dropping, we're increasing that insulin resistance. So we want to nurture that as much as possible. We need to learn to sleep so we support cortisol and blood sugar regulation. In this season of life too, people are like, oh, I'm a MyFitnessPal Pro. And that's not what we want. I want everyone to live big and focus on nutrition over calories. Now more than ever, I think if anyone's on social media, they know this message, the power of protein. Has everyone seen get your 30 grams of protein? And that's good. And I'm along with that message. But with Jenny's ice cream, I have product from her new company, Flora, like Gut Flora. They're 12 grams of fiber per bar. We need close to 40 to 50 grams of fiber a day. The average American's having close to 8 grams. So in this season of our life, it's the power of protein, but equally, if not more important, is fiber. That's where you can eat your whole real food more than not, and you can eat some bars like Flora, who she helped bring some product for everyone to take home today. But think of nutrition over calories. And supplements are really important. Supplements can help sleep, they can help that insulin sensitivity, and they can help fill nutrient gaps. I'm happy to take anyone's email. I'm going to send promos after today's presentation next week, but if you would like access to practitioner-grade supplements from Fullscript, it's really important because there's a lot of counterfeit in supplements, so I'll just leave that there. But overall, try to slow down when you can and know yourself. Know yourself. What helps you take a deep breath? And for me, I know that's often a quick walk outside. I want to move on to blood sugar regulation. Here's some symptoms if you have insulin resistance. It's not always a high fasting blood sugar. It's not always a high A1C. How are those triglycerides? I often see that really high, and that's usually high insulin in the body. High insulin in the body can be up 10 years before you have high blood sugars. So know your labs, look at them. Don't just look for the H and the L, but actually kind of look at them, see how they've changed from year to year. Overall, with insulin sensitivity, my 2 big tips: power of protein, always eat your protein first, hydrate, and sleep. Those are really important. And if you're eating food that makes your digestion feel off, I had a client, she's like, I eat Greek yogurt. I eat Greek yogurt to get that protein, but it makes me a little bloated. I was like, that's a sign from your body. Your body is your best doctor. If you don't tolerate it optimally, step away. It's creating inflammation. I'm gonna wrap up quickly, but again, after this, you guys can talk to me at my booth. Overall, this was just a client that came to me. She had Hashimoto's, low thyroid, an autoimmune condition, and we used food as medicine, and we actually brought her antibodies down. We identified some foods that were really reactive to her gut, and it helped her improve her gut health, improve her inflammation, lose weight, balance her hormones. Last but not least is supporting our liver. I'm going to plug that fiber message once again, but you also want to make sure you sweat. Sweating helps us detox heavy metals as best as possible, and we also want to take care of the gut. Every season, I'm also a yoga instructor. Ayurvedically, it's good to do some form of a liver cleanse. I think of it as like an oil change. Right now, I have 13 women doing a liver cleanse with me. I have a box over there just showing what the liver cleanse is. It's a 7-day program that helps cleanse the liver, but it can help reduce inflammation, it can help improve that insulin, and overall can help prime the body and metabolism. So I'm very passionate about detoxing, but I want to make sure I'm not going too long. So overall, this is information on my Real Food Cleanse. You can take a picture of the QR code. And last but not least, overall, cleanses are thought to be something as a fad, but I really believe their reputation as a form of self-care, may have gotten a bad reputation as a form of self-punishment for overindulgence or barbaric rapid weight loss method. But when done well, they can be a loving ritual of self-care, a means of slowing down and checking in with yourself, and a way of making your health a top priority so that you can feel vibrant, energized, and fully dialed in life. Cleansing involves changing one's lifestyle and diet to allow you to facilitate the detox process and take a break from whatever might be causing the issue, allowing your body to repair itself. Last but not least, I work with private clients in coaching, and I give them a workbook. If you would like access to that workbook, you can send me an email, and I will send that to you early next week. Protecting my boundaries, I'm trying not to work tomorrow on Mother's Day, so it will come soon. So that's it. Thank you so much. Sorry, went a few minutes over, and we have Dr. Ryan next.
Yes. Kelly, thank you so much. I, like many of you, were so excited to see Kelly's talk today. I've been myself wanting to take that time to hear what you have to say and the advice you have. I love the, if it's not a hell yes, it's a no. I'm going to put that in my pocket. I'm taking that with me. Next up, we have Laura Ryan. She is not just an MD endocrinologist specializing in diabetes and metabolism. She is also my lovely neighbor. Yay. Yes, Laura Ryan.
Thank you, Jess. Nice to see everybody today. I think you're going to hear a lot of similar themes today, and so that was a great talk, Kelly. I'm going to build on that, and I think a lot of things I say are going to be reflected, so that's good. So I'm going to try and distill women's health into 13 minutes, so we'll see how that goes. I'm an endocrinologist at Ohio State. I thought I would just start with the case. A 48-year-old woman presented to my clinic actually last week for worsening fatigue, and she wondered if it was her thyroid malfunctioning. And so, I sort of think about the fact that it's a woman, about her age a little bit. I think a little bit about this idea of fatigue. What does that really mean? And what is her thyroid doing? I can and often do spend a lot of time talking about the thyroid, and I guess I won't, really go into the entirety of the complexities of the thyroid, but I think it's interesting to introduce. The thyroid is sort of shaped like this butterfly gland, this butterfly shape. It's low in your throat. Its output is pretty simple. It makes thyroid hormone, but almost every tissue in the body has a thyroid hormone receptor. In a very simplistic sense, the thyroid hormone controls metabolism, but what that means is it really helps the brain to work. It helps the gut to work. It does help with sort of metabolism of energy. It has impacts on skin, on muscle function, mood, and all sorts of things. This is a women's health talk, and it's interesting how disease presents differently in women versus men. Thyroid dysfunction in the United States is oftentimes an autoimmune disease, and autoimmune diseases occur 5 to 8 times more commonly in women than in men. Not that I don't see thyroid disease in men, but it's definitely more common in women. Here are the symptoms, the common symptoms of hypothyroidism. And if you look over those symptoms, you'll see that they're just very nonspecific. Fatigue, depression, brain fog, muscle cramps, cold intolerance, weight gain, dry skin. None of these things are specific to the thyroid. If I could put up a slide of all the different causes of fatigue, and it would just run over. Fatigue is probably the most common symptom of so many diseases and other just sort of lifestyle states. So it's certainly possible that our person has thyroid dysfunction, but I think it's really important for your providers to think about other things that could possibly be going on when you come in with a symptom like fatigue. And so the first things that I might ask in that setting is, how is your sleep? And really, like, what do you mean by fatigue? Sleep is such an important, so I definitely agree with Kelly. Having good bowel movements is so important, and I think that sleep is so important. And so often people have difficulty falling asleep, they have difficulty staying asleep, and I agree that menopause is defined as no vaginal bleeding for 1 year, and it's very interesting that the average age of menopause is 51 because our average age of starting periods has gotten younger and younger over the past few decades, but since we've been measuring these things, the average age of menopause has not changed for over 100 years since we've been measuring. I agree, perimenopause begins 3 to 5 years before the last cycle, but it's different for everybody. Sometimes it happens 10 years before. Some people just fly through menopause with no problem at all. And something that Kelly said that I absolutely agree with is that going through menopause is like going through puberty in reverse. All of a sudden, your periods get crazy, the timing is off, you can have really heavy flow, light flow, and then mood lability, skin changes, acne, hair growth. It can be really challenging. And other parts of menopause include, or perimenopause, irregular cycles, and the vasomotor symptoms of menopause, which are, hot flashes, night sweats. It can be just waking up in the middle of the night and throwing your covers off, or it could be waking up being absolutely drenched in sweat and having to change your sheets, or even lay on a beach towel. Mood lability, decreased libido and sexual satisfaction, brain fog, and then I agree, joint pain, thinning hair, skin changes. And the really challenging thing about menopause is this is a lack of estrogen, but giving estrogen back doesn't necessarily change a lot of those symptoms. I wanted to point out that probably my favorite resource for information about menopause is from the Menopause Society, which used to be called the North American Menopause Society. They've sort of rebranded in the last couple of years. But I work at the Center for Women's Health at Ohio State, and a couple of my co-providers are just real experts in menopause, and this is their favorite website as well. And if you go to patient education, there's some really nice topics that you can read about. In terms of hormone therapy, I think hormone therapy is actually really complicated. There are certain situations where hormone therapy is absolutely should be considered. I'm not going to say absolutely indicated, but at least a conversation should be had. Estrogen, no question, is the best therapy to improve hot flashes and night sweats, and vaginal estrogen preparations are great for vaginal dryness and painful sex, and also urinary burning. But there can be contraindications to estrogen, and it's just really important to have a good conversation with your provider about whether or not hormone therapy is a good idea for you, and the pros and cons. And if you can't have that conversation with your provider, then I think you might want to get a new provider, because it's just really important to be able to talk about these things. However, when you look at the data, hormone therapy doesn't really help with mood, hair loss, cognitive functioning, or weight gain. Sometimes can even contribute to weight gain, but not always. Everybody's a little bit different. But this is a little more vague. I absolutely agree with Kelly that rarely is lab work necessary to make a diagnosis of menopause or even to follow along once you've started on hormone therapy. And there are potential side effects. And so there was actually, we hosted a CME conference on menopause at the end of February. And by far the most important thing is this concept of shared decision making. Working at the Center for Women's Health, I really enjoy working with women because women tend to be great advocates. You know, they come in, they have questions, and it's really interesting to just have a conversation. And this is how it should be with your provider. You know, what do you think about this? I read about this. Do you know about this? What do you think? Fatigue, very common. The medical literature would state that 21 to 33% of doctors' visits, fatigue is one of the complaints, if not the main complaint. There's different forms of fatigue that I try to sort of untangle. There's the fatigue of I could fall asleep right now versus kind of a generalized sense of weakness and lack of motivation versus like a physical, my muscles are tired. It can definitely be a marker of unrecognized disease. It could be a marker of anemia. It could be the first sign of cancer. It could be the marker of malabsorption in the gut with an iron deficiency or vitamin D. It can be the first symptom of depression. It can be side effects of certain medications. It almost always accompanies substance abuse. And so there's just so many things that go into fatigue that a conversation is important. And how about sleep? I would like somebody to tell me in this room that they have fantastic sleep hygiene. You know, that they don't take naps during the day, that they go to bed at the same time every night, that they are not on their screens for an hour before going to bed, that their room is quiet, you know, their bed is only for sleeping and sex. It's hard to, really have good sleep hygiene, and then a lot of my patients will get stuck in this sort of cycle of sleeping like just crap and then, taking a nap during the day and then, or coming home from work and feeling tired and taking a long nap. It's tough. Life, to find that balance. I love the idea of hell yes. All of my life must be hell yes because there's not very much no. So I'm going to think about that because I'm not sure it's all hell yes. Joint pain is can impact sleep. Is there snoring? Is it sleep apnea? Is it just organic insomnia? It's really important to talk about this. Make sure you're not missing anything and come up with a strategy. And women are not, small versions of men. Heart disease might present earlier. Their chest pain or pain from the heart might feel different than typical angina. Chest pain, the symptoms of heart disease is more likely to be experienced during rest or stress, not necessarily with exercise. Women are more likely to experience strokes than men, and that probably has a lot to do with estrogen. Interestingly, female athletes are significantly more likely to sustain a non-contact ACL injury than their male counterparts. Obviously, there's different types of cancer. Autoimmune disease is more common in women, including rheumatoid arthritis, lupus, multiple sclerosis, but women are also better at fighting off certain diseases like COVID. Now, what's not on here that I could speak about for hours is a disease that I feel very passionately about, and that's osteoporosis. And that's the other thing. Women are more likely to develop osteoporosis, and our peak bone mass begins in our youth, when we're teenagers, and we should be drinking milk, not soda, and we should be physically active. In the young women in our lives, they should be having cycles every single month. That exposure to estrogen in your teens and early 20s is so important for building maximum peak bone mass in the first place. Exercise is not being busy throughout the day. Exercise is so important, and it is physical activity that is planned, structured, repetitive, and purposeful. I agree with Kelly that the diet is so important, but I'm actually going to spend a couple minutes talking about how strongly I feel about the importance of exercise in preventing disease and having maximal health. The evidence-based proven effects of exercise include improved sleep, improved mood, improved libido, reduced cardiovascular events, reduced death from all causes, a lower incidence of cancer, reduction in the incidence and progression of diabetes, fewer falls from better strength, and improved cognition in both young and older adults. Now, exercise has not been proven to prevent or reverse dementia, but it does improve cognition in general. And the recommendation is that exercise be multimodal, that we use lots of different types of exercise. I'm super excited that our physical therapy colleagues are here today, and I'm excited to learn from them. But what I tell my patients is that most of my patients say, I really like to walk. I have a new puppy. Walking is my preferred mode of exercise. And I'm like, that's great. But you really have to be more intentional with your exercise. Exercise has to include resistance training. It has to include some weights. I was at a conference for osteoporosis last week, and there was a fair amount of time spent on the Lift More trial, which showed that heavy weightlifting really, under supervision, really significantly improves bone density, bone strength, and maybe can reduce the incidence of fracture. This sort of exercise, which as you can see requires hardly any equipment at all, really is important for improving insulin sensitivity, improving muscle strength, preventing falls, preventing disease, and just sort of living your best life. Oh, yeah, I'm starting a route as well. I'm just going to put a quick plug for Ohio State's program, Exercise is Medicine. I think I made 5 referrals to Exercise is Medicine just in the past 3 days. This is a really interesting program. So if I have a woman who comes in who's just had a vertebral compression fracture, I say, you need to go to physical therapy. You need to learn how to improve your balance, improve your core strength. We need to reduce the pain of this fracture. But sometimes I'll have women come in and they're like, you know what, I know what you're saying. I know I should do some resistance training. I just don't know where to start. Or I feel intimidated by a gym. I feel intimidated by weightlifting. This is a really great program where it's there's supervision, you come up with a particular plan, but also, there's this progression to where you feel empowered to exercise on your own and to make really intentional exercise part of your lifestyle. And then I finally want to finish with this, and I think this is just so important in women's health, in all of our experiences with our providers, and that's this concept of shared decision-making. My observation is that my job is most satisfying when my patients participate in this process, and I think health is better when you feel like you are heard and you're making the right decisions for you. So I would say be your own advocate. Speak up. If something isn't working, say something about it. Come to the office visit prepared with questions. If you see something and you're curious about it, ask about it. Discuss your options. Ask if there are other options. Sometimes there's lots of other options. I tell my patients with diabetes, there's 20 different ways to skin this cat. Here's a lot of different options. Now, sometimes one option is clearly the best. Whether or not to receive vaccinations, one option is the best. Whether or not to treat bacterial pneumonia with an antibiotic, yes. But most of the time, there are many options, and it's important to discuss. And I'm going to tell you that it is okay to get a second opinion, and it's okay to follow up with your provider if you have more questions. And I think that's all I have for today. Thanks so much for having me.
Thank you so much, Laura, for being here today and sharing your expertise with us. I think we all needed to hear that from a professional in your field to say, be your own advocate. And we really appreciate you supporting all of us as women to be our own advocates. Gigi Howard is our next presenter. She's a certified trainer and CEO, owner-operated of Female Fight Club. Gigi.
Hi, guys. Okay, because I'm a personal trainer and I'm the last one to go, let's stand up and do 5 squats, please. I need this as much as you guys do, so let's go ahead and squat, please. All right, just 5 body weight squats. Feels good. I'm sorry to all my clients that are here that they're like, you're not in your leggings. Stop telling us to do squats. I'm sorry. You still have to do your squats. I am a certified personal trainer. I'm the owner of Female Fight Club. We're located about 10 minutes from here. I did say Female Fight Club. There's no fighting. It's actually just strength training. The name comes from the motto. It's what are you fighting for? Because we're all fighting for something different. And I just love this picture because this is just a clear picture of what it looks like at the gym. You walk in, you see someone that's 10 years old. And then Peggy to my right here, she's a client of mine. She'll be 82 in November, and she deadlifts as much as some of my 35-year-olds. She's incredible. And today I get to talk to you guys about strength training for women, hormones, bones, longevity, all that important stuff. So why do we have to talk specifically about women in strength training, and why not just strength training in general? And why is that different from men and women that are strength training? Who here has been told any of these phrases over their whole life? Any of these phrases? Eat less, move more, do only cardio, don't lift heavy weights. I've heard these day in and day out. I still hear them, whether they're telling me or telling a client of mine. This is the ideology that we've been fed as women over and over and over again. And we're gonna talk a little bit about why is that happening? And I think Dr. Laura Ryan, you had the same quote from Dr. Stacy Sims. Women are not small men. I love this quote so much, it's so true. She says, we can't just shrink it and pink it and expect it to be a women's product, throw some sparkles on there and boom, there we go. That's not how it works. We're far more complex than that. So a little background of a story that I think will kind of give some light to why is this an issue? Why for women is this such an issue? Last year and the year before, I had the honor of teaching at Otterbein University, and I taught a course called Exercise Testing and Prescriptions in their exercise science department. And in that course, I had to stay pretty rigid to what the course was because my students went on to take the exam through American College of Sports Medicine to become certified personal trainers. And in that course, I had to stay pretty rigid in what I was teaching. I couldn't stray away from the certification that they were taking at the end of the semester. The problem with the information, nothing against Otterbein University, it's a wonderful place. That's actually where I got my bachelor's as well. It's the problem with American College of Sports Medicine is that all of the studies, and I think this was mentioned earlier, they're done on men. And so all of my students that were going on to be personal trainers and exercise physiologists to train men and women, they were just learning one side, one piece of the puzzle. And no one knows this. So our people are getting educated and they're going out and they're training general population with the best of intentions, and it's just based on male studies. And this is not uncommon. We see this all the time. And the problem is because there's not much literature, there's not much research for women. It's not that people are targeting women, kind of, but they're not necessarily doing it on purpose. It just doesn't exist yet. So we don't really have a lot to base it off of. So what can we do? We can look to people like Dr. Stacy Sims. She's a wonderful person. She is a researcher. I don't know her personally. I'm assuming she's a wonderful person based on what I know. But she's a researcher at the University of Stanford, and she is very new, and not new, but nuanced in this women's health space, very researched in that strength training space for women. Yeah, she's really fun to follow. She has an Instagram and podcast and all that jazz. But so how does this work? So 3 things I want to talk about today, 3 pillars, neuromuscular adaptation, bone density, and muscle strength, and how those pertain to strength training and how they pertain to it. So that first word that I pulled out, neuromuscular adaptation, is basically just a real fancy, sexy word that means your body adapts, and your body is really smart, and it's really resilient, and it understands if it's gonna be under stress, how do we make this a little bit less stressful next time? So, for example, we go into the gym, say you're a beginner, and you go in, you pick up a 10-pound dumbbell, and you go and you do your squats with it. And you go home, it's your first session ever at the gym, you go home, and you think, your body's thinking to itself, that was kind of stressful. Like, we've never experienced something like that before. So your body's gonna say, how do we make this a little bit less stressful next time we go? Your body recruits something called a motor unit, which is just, in general terms, another part of your muscle. Just kind of flicks on these other parts of your muscle that are saying, hey, we had something stressful happen today. How can we make this less stressful? Let's pull in some other parts of our muscle and see if adding that part of your muscle will help. And that's exactly what your body's doing. It's just saying, hey, let's just make this a little bit easier. So we go to the gym next time over and over and over again. We grab that 10-pound dumbbell. All of a sudden, it's a walk in the park. You're like doing it in your sleep. Your body's like, boring, seen this, been there, done that. And this is the problem, is that we keep picking up that 10-pound dumbbell. But we can't do that. We have to constantly be progressing, because what's your body gonna do? It's gonna adapt. Every single time you're in the gym and you pick up a heavier weight, whether it's 1 pound heavier, it's 5 pounds heavier, it's 100 pounds heavier over time, your body's thinking, okay, we've got this. Let's adapt to this. Let's make this a little bit easier for ourselves next time. All right, bone density. That's like such a hype word these days. Who here has been to the doctor or knows someone that says, hey, you need to get a DEXA scan, or you need to get a bone density scan? Anybody, or know somebody? I know, like, everyone walks in, or someone walks in the gym once a week and they're like, hey, my doctor told me to come strength train because my bones aren't good anymore. I'm like, you're in the right place. And yeah, we talked about this earlier. The reason is that our estrogen drops as women are in that perimenopause, menopausal state, and postmenopause. We're losing estrogen, so our bones are like, all right, see you later. We don't really need to be around anymore. With that bone density too, so what's going on? Why does strength training actually work? We hear that all the time, but what's actually going on? When you are strength training, very similarly to that neuromuscular adaptation, if your muscles are saying this is stressful, so are your bones. And so if you're loading your bones, your body will release something called an osteoblast. Osteo meaning bone, blast meaning build, bone builder. Your body will release that and say, okay, let's build some denser, stronger bones so that next time this happens, this isn't stressful for us. Your body doesn't want to get injured. Your body is like totally trying to protect you all the time, all day long. So every time we put it under stress, it's saying, how can we make this less stressful for ourselves? I love this analogy. Your bones are like a savings account, and lifting heavy is making deposits. If we're only lifting those 1 pound, 2 pound weights, your savings account and your bones, I mean, it'll be something, right? It all adds up. But it's not as big as if you're making these big, heavy, nice deposits into those bones. And that has to start when you're young, when you're in your 20s, when you're in their 30s. And then when you get to that stage, you're good to go. Your savings, your bank is already pretty full. And you're not gonna lose that bone density just because your estrogen is declining. So moving into strength, frequency, and type, we do differ. Women, we're very complex. And even though we're all women, our age does matter because it depends on where we're at in that, in our womanhood, right? When we're in our 20s, we're a little bit more fluid. We can kind of get away with a little bit more. I'm 27, I can kind of go out and, one day maybe I'll do this and one day maybe I'll do that. I'm not saying I do this. I am more complex or more put together with my training, but I could get away with a little bit more right now. Once I get into that 30s and 40s and beyond, I have to be a lot more selective actually with what I'm doing so that I can maintain that bone density, maintain my strength, increase that neuromuscular adaptation. And it's not a lot. 30 to 45 minutes is plenty. I'm gonna couple the 30s and 40s and beyond together. It's pretty simple, 2 to 4 times a week. With that being said, I don't want you guys to go into the gym and say, hey, Gigi Howard told me that I need to lift really heavy, and then you go ahead and get injured. We're gonna talk about what progression looks like too, especially if you're a beginner, whether you're in your 20s, 30s, and 40s, you don't wanna just jump right into strength training because it can be dangerous. Same thing with your bones, like I said, happens to your muscles. In that postmenopausal or menopausal, perimenopausal, you're losing that estrogen. Same thing with your bones, they drop, and your lean muscle mass, your muscles. They're like, again, see you later. If you don't use it, you lose it. We all hear that all the time. But it is so true. If you are losing that estrogen and progesterone, your muscles will not be able to repair themselves as easily. So how heavy do we need to lift? We're gonna use a term called RPE today. Does anyone know what that means? I know some female fight clubbers in here know what that means. We use that at the gym. It stands for rate of perceived exertion. And all that means is on a scale of 1 to 10, if I said, hey, how heavy does this feel on a scale of 1 to 10, 1 being really light, 10 being really heavy, it should feel like, if you're a beginner, it should feel like a 4 to a 5. So we're not talking super, super heavy, and you're looking a little bit more in that higher rep range so that we're working on, can we get muscle memory doing this? Can we focus on our form while we're doing this before we increase the weight? If you're intermediate level, maybe you've been coming for a couple months or so, you're a little bit more confident in the gym, we're looking at that RPE of 6 to 7, so a little bit higher. And as RPE goes up, your reps generally are gonna come down. 1 usually has to give so that we can maintain that heavier RPE, that heavier rate of perceived exertion on that scale. If you're advanced, we're looking for more of that RPE of 7 to 8 for 5 to 6 reps. We can also see a RPE of 8 to 9. It just depends, again, kind of how confident you are, how comfortable you are. Are you working with a personal trainer? Are you taking classes? Things like that. That being said, when you go into a class at Female Fight Club or anywhere you're at, you don't have to do everything at an RPE of 8 to 9 if you're advanced. A lot of times it's gonna look like you're gonna pick one heavy movement. So say you pick squat, and your squat that day is gonna be pretty heavy, you're gonna complement and accessorize that squat with other things that are gonna put that joint through the full range of motion, that are gonna allow your spine to move nicely, that are gonna activate that deep core. So I'm not saying we need to go and just do like the heaviest things you've ever done all the time, but part of your workout absolutely should challenge you from a strength perspective. And then just finishing with some amazing, motivating, and inspiring statistics. I put in all my favorite words up there. But I love the science behind it. We can talk all day about, opinions, and there's opinions on everything. There's podcasts on everything. There's Instagram stories on everything. Everyone wants to share their opinion. But these are just the facts. Like, we just know this is true. We've got to hear that from some experts here today as well. This top one, 10-week period, 7 to 27% stronger. That's like tomorrow. 10 weeks is 2.5 months. That's no time at all to increase by 27.8% just by starting strength training. Postmenopausal woman, we talked about hormone replacement therapy today. This was a study done, 24 weeks, postmenopausal women, strength training 3 times a week without HRT compared to the untrained group. The training group showed significant improvements in body comp and muscular strength, and then the other group lost some bone mass density while the other one maintained bone mass density, again, without hormone replacement therapy. This next one is my favorite. 28,000 women, 62.2 years, 29% reduction in all-cause mortality. We'll just call it 30%. That's incredible just by strength training 20 to 59 minutes a week. It's like 5 minutes a day minimum. That's no time at all. If you're working really effectively, really efficiently, and you can reduce all-cause mortality by 30%, like take the 2 minutes that we were talking about here, combine them with 3 more, and you're good to go. You're 30% less likely to die of all-cause mortality. And then last one here, 2-year randomized control, 3.68% decrease in body fat percentage and a 14.3% reduction in intra-abdominal fat reduction there. This is a big one, 14.3, especially in that woman that is postmenopausal, menopausal. We're seeing more of that intra-abdominal fat, also known as your visceral fat. It's the more dangerous type of fat because it's surrounding your organs. But just by twice weekly strength training, decreasing that intra-abdominal fat and just overall body fat percentage. So if you guys take anything away, I hope you guys get into strength training. It is not a scary place. We just have to start somewhere, and then you're just progressing into it. We have people that come into the gym that have literally never been in a gym ever, and then next week they're bringing all their friends because they're like, I love this place. I feel so comfortable here. I feel so confident here. It's just a group of a bunch of women hanging out, and we do lift weights. We get done what we have to get done. But you guys are really strong. Again, women come in that they're like, I'm not strong at all. My husband doesn't let me carry the groceries inside. I'm like, sis, get in here. Like, pick up this 20-pound weight. I don't know. Like, we're going to fix this problem. But you guys are really strong, and come check out Female Fight Club. We're just 10 minutes away. Thank you, Jess.
Thanks. Gigi, amazing, motivating, and inspiring is you. And Female Fight Club, I say check it out. I grew up as a young athlete, very comfortable in gyms, but Gigi is something that you want to be around, and the women that she brings into that gym are inspiring, and there's a mirror ball. It is a lot of fun. So check out Female Fight Club. She's changing lives, and I appreciate her being here today. Thank you, Kelly, Laura, Nicole, and Gigi, and all of our incredible vendors today for saying yes to being here and pouring into this community. Let's make today a celebration of strength, connection, and self-care, because when women are healthy, families flourish, communities thrive, and the world simply changes. Let's rise together, one empowered woman at a time. Thank you for being here today. And feel free to go around and check out our amazing vendors and continue to empower and equip yourselves, women. And for those of you who are celebrating, happy Mother's Day.